Hello, everyone, and welcome to August Ask the Expert webinar. We are PSC Support. I'm joined today by Alice Freer, both a wonderful person, and she's also a senior therapist and a research fellow at the Queen Elizabeth Hospital in Birmingham here in the UK. She is going to give us a short presentation on fatigue, about what it is, what we know about it, maybe even things we don't know about it or what we're looking into. And she recently actually gave us a talk similar to this or like this at our Newport Information Day, which if you came to, you would have seen and you would have realized how brilliant it is and how useful it is to have someone with this knowledge talking about fatigue. So we thought we'd ask her along to give us and ask the expert on it, and then we can embed this into our webpage and the information will be there for everyone to see.
Thanks so much, Mark, for that warm introduction. Thank you so much for having me. I want to try and be as informative as possible to the listeners and, of course, the audience, but also try and give you the knowledge that you may require around the debilitating symptom that is fatigue in PSC. So what I'm going to do is I'm going to share my screen. Hopefully you'll have no issues, but if you do, just pop something in the chat function. Talk to you for maybe 15 or 20 minutes about fatigue, and then really it's your session, so open it up to questions and I'll try and answer as many as I possibly can within the time constraints. As Mark mentioned, I recently did appear in Wales and presented a much longer presentation on fatigue, so this is more of a condensed down version. So if you did attend the Welsh Day, you may see some familiar slides, but hopefully it will just be a reminder of the salient points that we talked about. So I'm just going to try and share the screen now. So unfortunately, I imagined the pictures in the opening slide resonate with a few of you, but what we really want to talk about today is what fatigue looks like, and potentially what we know about what causes it and what we're hoping to try and do about it as clinicians. So as many of you know, fatigue is a debilitating symptom that comes hand in hand with PSC, but really challengingly for clinicians is it doesn't necessarily match liver disease severity. So your PSC can be relatively stable, but your fatigue can be extremely profound. And we're unclear as to why that is. But what we do know is that fatigue can manifest in two forms. So that can be centrally or peripherally. Now, centrally, it tends to manifest more as memory disturbances, so like recalling experiences or particular words, or you're having conversations and you lose your trail of thought. Sleep disturbances, so that can be not just trying to get to sleep, so that's what we call sleep latency, but also waking up regularly throughout the night, or having significantly what you perceive to be good sleep, but the quality is actually really poor. And even if you've had 10 or 12 hours in bed, you can wake up feeling extremely tired still. And then also that increased daytime, what we call somnolence. So that is where you feel you could drop off at any moment, or be working quite well. And then suddenly almost these shutters come down and you feel like, oh my goodness, if I don't stop and go to sleep, I'm not going to be able to continue with my day. And, unfortunately, fatigue is unforgiving. So it doesn't matter if you're in the middle of something really important, if you're in the middle of a work meeting, and that those shutters just come down, and it can be really, really debilitating and really frustrating for the individual. And then we've got the other side of things where it actually affects you peripherally. So that's your ability to do things. So whether that's everyday tasks, whether that is exercise, if you do have planned structured exercise in your day-to-day life. It also increases what we call anaerobic metabolism. So that's when your body has to work without oxygen to create energy. And unfortunately, that creates nasty byproducts called lactic acid, and that can cause pain within the muscles. So there's actual altered what we call muscle bioenergetics. So therefore, your ability to clear out that lactic acid. So you are left with sort of this ache, pain, which is much more severe than the person without perhaps cholestatic disease. And in turn, that therefore requires a lot of recovery time. So compared to perhaps somebody that doesn't have PSC, you could both perhaps have the same level of exercise tolerance, both run 100 meters, but it would take the person with PSC potentially longer to recover than the person without. And then, of course, let's not pretend that individuals can present with both. So you might resonate with one or the other, or you might think, well, actually, I have a combination of both. So that is fatigue in a nutshell in PSC, and particularly within liver disease. So In terms of cholestatic disease, so really drilling down to PSC, the problem is that although it's reported in 7 out of 10 people, so that's the prevalence, the mechanisms of why are really poorly understood. And that is a problem for you as patients. And it's a massive problem for us as clinicians, because without understanding the mechanisms, how are we meant to offer treatments? What we do know is that it offers a really high burden and therefore reduces quality of life significantly, because in the absence of knowing how to manage it, patients often tend to do less. And now that isn't a criticism, it's about ring fencing and keeping things safe for the individual. And what they do know is if I do less things to trigger the fatigue, hopefully therefore I won't have fatigue. But what that does is it strips patients of their independence and their choice of what they would like to do, whether that be work, social, or family related. Again, problems is in terms of assessing fatigue, it's not routine within clinic, or patients actually don't bring it to the table because they're often faced with a response of, well, we don't really know what to do about it. So patients aren't talking about it, but therefore it's also not assessed, and it's not assessed well. And there's nothing really specific to assess fatigue in PSC. And that is something as clinicians we need to change. If it is assessed, the advice is often inconsistent or vague. So it's a little bit of a postcode lottery, depending on the experience within the room of the clinician. Or you're told there is no treatment, it's just part of your liver disease and it's something you need to manage. And then some individuals have come forward, some patients have said that maybe they've been offered some lifestyling or coping mechanism advice. But in the absence of really knowing that patient, it's really hard to just say, right, well, with your fatigue, go off and do X amount of exercise without really drilling down what your concerns are. So what do we believe to be the contributors to fatigue? Well, we think potentially there might be a little bit of autonomic dysfunction, which I'm going to go into detail of all of these on the next few slides. What we do believe is that sleep disturbances can have a profound impact on fatigue in patients. Physical pain is really not something to be underestimated, and how that then in turn can influence things like sleep. The psychological distress that is caused hand in hand with either fatigue, your liver condition itself, and then you get this sort of circle of debilitating decline, because it's trying to then unpick, is it the fatigue that's causing the psychological distress, or are you in a period of psychological distress because of your liver disease, which therefore causes fatigue? And then, of course, a lot of our PSC patients have underlying inflammatory issues going on. So whether that is inflammatory bowel disease, these also can contribute to overall fatigue. So you're not just maybe dealing with fatigue driving from the liver, you're also having it driven from the gut itself. Now, if anyone can see on the screen, my Labrador is trying to attack me under the table, so I do apologize, but I will continue on. So in terms of autonomic dysfunction, gets a little bit scientific here, so please scribble away your questions if you want to dive into this a little bit more after the presentation. We have a parasympathetic nervous system and a sympathetic nervous system. So your parasympathetic autonomic nervous system helps to lower your heart rate, helps to stimulate digestion, helps to lower blood pressure, and helps to conserve energy. Whereas your sympathetic autonomic nervous system helps increase your heart rate, increase your blood pressure, and helps with your emergency responses. So that classic flight or fight response. Now, they're both very good in their own right. However, if there is dysfunction there, it could be that you flip between the two quite quickly, and that can cause real problems for our patients, whether that's feeling of dizziness, feeling unwell, nauseated, and it can be mild or severe, but ultimately result in these problems. So difficulties with your digestion, difficulties with your bladder and bowel function, altering that heart rate all the time, that dizziness and fainting, as I've mentioned, vision problems, and of course, nausea. Now, if you've got all of those things going on in the background, and then you're faced with working or perhaps a family commitment, the likelihood of you performing to the best of your ability is somewhat hindered. And quite often, patients feel like they need to sit and rest, which overall contributes to their feeling of fatigue and potential that psychological distress, which leads me nicely onto it. So in terms of psychological distress, what does that mean for our patients? Well, unfortunately, it can cause sleep disturbances. So that can look like insomnia, so the ability to get to sleep. It can result in really poor sleeping patterns and that reduced restful sleep. So what I mentioned at the start of the presentation, so patients going to sleep having 10 or 12 hours, but waking up feeling extremely tired still. In terms of mood and emotional impact, well, what can it do? So you have that increased steroid hormone, so that cortisol. So if you're in a period of psychological distress, you can have increased amounts of cortisol within your body, which in turn can have influences on your digestion and your element of baseline inflammation within the body. It can also be an increased cognitive load, so that inability to switch off and relax and have meaningful rest. If you're feeling like you've got lots of things on your mind and they're not being addressed, you feel like you're carrying an immense burden around a symptom that is just not well discussed or you feel well informed about. Can actually cause problems with your immune system and the function. So as I've talked about, that prolonged stress, that inflammatory response from potentially cortisol can suppress immunity, and therefore infection can contribute to feeling of overall fatigue as well. So I'm sure you're starting to see that all of these different potential mechanisms actually interlink really, really well together, which is helpful for clinicians, but not helpful for patients, because it's trying to work out which part is causing your fatigue symptoms. And then actually the physical problems, we need to address that as well. Even having psychological distress, it can result in severe headaches, it can result in severe disturbances in gut health, also cause muscle tension and pain. And then if we've also got other things like pain going on or problems with peripheral fatigue, all ties together, making the problem worse. Overall, really, what we then need to think about is how does that influence your cognitive load and your cognitive ability? Well, what we do know is with all of those things going on, it can impair your decision making, it can impair your contribution to daily tasks and your concentration, and that ability of sort of, who are you as a person? If you're not able to do the things that you want to do, or you're not able to do the work that you want to be able to do, or you're not being able to engage in family or college, etc. It's very, very stripping of your identity. And also, if you have significant psychological distress, it can actually alter the perception of the fatigue, which leads to a debilitating cycle. Now, that isn't to say that you're making it up. Absolutely not. But if your mindset is one very distressed or psychologically very distressed and your mood is very low, it may feel like symptoms such as fatigue are much, much greater than perhaps if your mindset was in a different space. So sleep disturbances then, what can happen in liver disease? We know that it can impact on something called the circadian rhythm. So that's your body's natural rhythm to fall asleep and wake. And that is from hormone dysregulation. It can also have a significant impact on thermoregulation. So that's your temperature. Having those prolonged states of inflammation, as we've mentioned, is not good for the body long term. And therefore, if you're feeling very, very fatigued from sleep disturbances, it's going to alter your physical activity levels, which in turn is going to reduce your physical fitness and the ability at which your muscles can cope with stress. In terms of that central disturbance, then it can interfere with your brain function, it can impair with your memory consolidations, it impairs your cognition and your concentration. And as I've just alluded to, from a peripheral point of view, it can impair that muscle recovery and repair, also causes problems with disruption of hormone regulation, and of course impacts on immunity. So again, I know I feel like I'm repeating myself, or perhaps it feels like I am, but what I'm trying to get across is that all of these things are interlinked, and it's about identifying what it is within the individual that is causing the biggest problem and how we can work on it. And then this again is something that we really must address, and that is pain. Pain and fatigue are two things that PSC patients significantly suffer with, but there is significant poor management of both of them. Now, the problem is, in terms of physical pain, is that quite often patients report muscle tension and perhaps overcompensation, and pain then contributes to overuse, and this can cause a cycle of triggering fatigue, resulting in more pain. And because you've got an inability to recruit the muscles appropriately because there's dysfunction within that muscle circuit. Inflammation, as I've mentioned, so if you've got high amounts of cortisol or you are in a state of inflammation, pain often triggers an inflammatory response. So it drives that inflammation again further, which causes an increased energy production to respond to inflammatory responses. So you're having to then produce energy to help respond to the inflammatory response, which in turn can then have an impact on your fatigue. Unsurprisingly, that will then affect your physical activity levels. So pain then can limit participation in functional activities. If you're in pain, you're less likely to be able to engage in the things you want to be able to do. And also patients, quite rightly, are less inclined to exercise because they feel like it's going to cause pain. But that in turn, again, adds to the fatigability of the muscle and therefore the tolerance of what it can cope with. And then, of course, if we're in physical pain, the sleep disturbances itself, it causes real problems getting off to sleep. It causes issues with sleep quality, and it also therefore influences the quantity of sleep that you guys receive as well. Now, oxidative stress, an important thing to bear in mind. So this is the imbalance between oxidants and the reactive oxygen species. So this, again, activates the immune system and therefore, again, offers increased inflammation. So it is thought that patients with inflammatory autoimmune disease have a higher state of oxidative stress, something which we do need short term, but long term, it just adds again to this increased burden of inflammation and therefore fatigability. How does this look then? Well, from a central point of view, it influences your central nervous system disruption, so sending messages from the brain to the muscles. From a DNA point of view, it causes abnormal modifications and it breaks down those DNA strands and causes cellular dysfunction. From a gut point of view, it massively disturbs the microbiome and it can potentially damage the intestinal barrier, which is a reduction and causes a reduction, therefore, in the good bacteria within the gut. And then from a protein point of view, which we know are the building blocks for energy, it can damage and dysfunction and dysregulate this process and also influence, again, cellular function. So from a physiotherapy point in PSC, if we can put all of this together, and this is sort of where I'm going to conclude and allow for questions, and hopefully some of those thoughts will resonate with you. The stigma around physiotherapy and what we can offer to patients with PSC, and is I think we quite often get misrepresentation, and that is that we're just going to say, here's some exercises, go home and do them. But what we've actually learned throughout this process, and me certainly within the last 5 to 10 years, is that we can't just be prescriptive. We can't just say, right, you need to go off and do X amount. What we really need to do is, yes, I do believe exercise potentially can help with fatigue, but we need to be looking at you holistically. So what is your health and overall well-being? How can we holistically influence your treatment, and how can we get other people involved, and what is it that you require? What is your energy expenditure, and how do you best want to use it? How severe is your fatigue, and when does it hit you? Is it all the time? Is it more profound? Can we come up with strategies on when it manifests itself the worst or the best, and therefore try and optimize on when we can perhaps add an adjunct in, such as an exercise referral scheme? And of course, just looking at sleep. What is your sleep pattern? Why do we think it's dysregulated? Is there something that we can be working on? So what I'm trying to say from a physiotherapist point of view is that we're trying to look at you as a whole. We are trying to look at you from multiple angles to try and determine which part we need to work on to offer the best improvement in your symptom burden. Considerations then, well, it's really important that we offer a personalised approach. It's absolutely critical in my opinion. And yes, I am always willing to do sessions like this, answer questions as best we can, but it's really about learning about yourself and what you can do as an individual to try and help manage this symptom. We don't have a cure, and that's not ideal, and we need to be working on trying to find treatment options for you. But in the absence of that, what can we be doing? Because you're a really proactive bunch, but what can we be doing to try and help patients on an individual level? We need to be responsive and adapt to holistic programs. So we need to be listening to our patients. We need to be listening to you. And as family members or carers or the person with PSC, listening to yourself and being adaptive to a program, whether that's progress or regress, is really, really important. And trying to move your mindset away from, if you restrict what you're doing, are you actually taking steps backwards? Not necessarily. You might be doing less to give yourself more opportunity. So it's about shifting mindset. Behavior intervention is crucial for long-term change. That's really important. How we frame things and how we give and empower our patients to feel brave, to feel strong, to do the things that they want to do is ultimately going to lead to that long-term change. And then in terms of rapport, well, rapport with your clinician. If you have access to a physiotherapist, great. But if you don't, just having that rapport with your hepatologist or any member of the healthcare system, I think is really invaluable throughout your patient journey so that you can have a voice. And it's really important that in an underrepresented or underspoken about symptom, that you are passionate about bringing it to the forefront of your clinic appointments, even if it sometimes feels disheartening when they say, unfortunately, there's not a lot we can do. It's keep knocking on the door and saying, this is a real problem, because the more patients that speak up about it, the more likely there is going to be investment into what we can do about it. So that's kind of it from me in terms of a little bit of background into fatigue. Hopefully that was useful. I think I've stopped sharing. Is that right, Mark?
You have, yes,
Yeah.
and I am back. That was absolutely amazing. And having seen you give similar presentations before, I'm always amazed at how deep and complex of a symptom and a study and a research prospect fatigue is, because there's so much that is interlinking. And I think
Yeah.
everyone who has been watching can identify with certain parts of that. I 100% identify with the brain fog that you talked about, the curtain just coming down, and I could be mid-sentence and suddenly I can't remember why I'm saying the words I'm saying, and things like that would impact me quite a lot. And I think from the number of questions that have come in, we've got a lot of people who want to ask me. So I'm going to work with the upvote system people have been using seems to be working really well. And Martin's flagging a few that I can see. One of the easy ones to answer, which isn't high up, but I think is an important one, is people are asking if they can have a copy of your presentation after this.
Of course, that's absolutely fine.
I can make sure when we put this up on YouTube, I will email everyone who was registered, and I'll make sure that's attached to the email that goes out. I'm just going to start working down the list because you are going to be the one to answer these questions. So
No
the
problem.
first one is talking about inflammation. I've read osteoarthritis itself can cause significant fatigue. Do we know how this relates or interacts with PSC fatigue? And does fatigue come from both, or are they similar or separate? Or that would be wonderful if you could speak to that.
Yeah, of course. So it's a really good question, firstly. And what we do know about fatigue, if we look at chronic conditions across the board, whether that's gut related, whether that's liver disease related, whether that's even neurologically related, so perhaps MS or Parkinson's disease, is that we know that fatigue often presents very similarly. But what we're unclear of is the mechanisms as to why. Now, what I would potentially say is something like ulcerative colitis will probably add a different component to why you're tired, because if you think about what ulcerative colitis does, it essentially inhibits good absorption. It inhibits, therefore, the products that you're eating, and therefore the ability to create, store energy is compromised because you're not actually necessarily getting what you require especially in a flare. Now, it might be that that is relatively settled, but then you've got the liver side of things when we're thinking about your PSC side of things and the dysregulation that's happening within the liver. You'll have a secondary strand there with the inability to potentially store good energy and create good energy from what you've laid down within the liver and those building blocks. So I would say it would be very hard, and this is being completely honest, it'd be very hard to know when you're fatigued what's driven that. What has driven that? Is it your potential IBD, or is it your liver? What I would say is do an internal check-in on yourself and just see where your symptoms are. So are you currently in an acute flare of your IBD, or are you in an acute flare, maybe you've got some cholangitis, etc. And then you might be able to pinpoint essentially where it's come from. In my opinion, do we need to know necessarily desperately where it's from? Well, yes, if we need to know how we're going to manage the symptoms, because if it's an absorption issue and an energy production issue, then we need to know that so that we can then offer an appropriate treatment. So I hope that sort of helped a little bit with answering.
I think so. And I suppose in a sense, it doesn't matter to us as a patient where the fatigue is coming from. We're still experiencing fatigue. And I think you've
Yeah,
expertly shown that it is a big burden.
Yeah, I think it's important to acknowledge to the patient that whatever their symptom is, it's valid and it's important. Now, I would say that PSC patients are very akin to my type of personality, and I would want to know where it's coming from. You know, I feel like if I got a bit, potentially fobbed off of, well, it's just fatigue, I'd be like, but where is it coming from? Because if I know where it's coming from, I might be able to manage it a little bit better. So I do think it's crucial to understand, but the problem is we just don't know. So it's about how could we in the future highlight for different things, and what are the signals in terms of fatigue, and what do we need to look at, and what could we be testing for to try and identify it. And what I would suggest in the interim is trying to look within yourself and be like, right, okay, is everything stable? Is everything stable as it can be? And in that instance, you might be like, well, it could be either, and I can't profess to tell you how to identify it. However, If it isn't, and there's a potential flare, it might be that the fatigue looks the same. So it might be that you get central fatigue, or it might be you get muscle aches, but you'll be able to pinpoint, well, it's probably coming from this because I've got these symptoms. And then you might be able to be better prepared for how to manage that, and therefore your fatigue is probably.
And I just wanted to highlight something else you said towards the end, which is that sometimes PSC patients don't mention fatigue when they go into their clinics, because we have been told, or a lot of us has been told, well, there's nothing we can do. And so we stop bringing it up. But you mentioned the more we bring it up, the more the doctors and the healthcare professionals are going to realize there's a push from the patients that we want this looked into and we want this solved.
Mm-hmm. And actually the hepatology teams are actually really good at being a little bit more holistic, and they'll, if they're sat in clinic and 80% of their patients bring up fatigue, they might go, look, did anyone else have, so-and-so, how much was fatigue to it? Like, what are we doing about it? What is out there again? Didn't so-and-so do something? Like, how can we get something like that? Whereas if it's not mentioned, and the answer frustratingly initially might be like, I'm sorry, there isn't a lot we can do, there might be this, or try this. But if you're consistently bringing it to the table, if you feel you have the mental capacity to do that, and by that I just mean it's really disheartening when a clinician says there's nothing we can do, and it feels like, well, what's the point? I'm here to say there's every point. If you feel that you want to bring it up, you should, because there are people like myself that are really passionate about this symptom burden, and the more noise you make, the more likely we are to come up with research projects or get vested interest from other clinicians to support.
I'm sure we'll come back and talk about research projects towards the end. We have a question. I get to refresh on my screen and all the questions jump about. So are there any strategies to increase energy in a healthy way that you could suggest?
Okay, so really, again, it goes back to looking at yourself intrinsically. So when do you feel you have the most energy? And that could be any point within the day. Some patients with PSC find the morning much better, and some people find the evening much better. In my experience, I find that patients often have an initial groggy bit the first part of the day, then they have a good portion, and then the fatigue sort of creeps in again. Alongside itch, we need to mention itch as well, because as we go through the day, basal temperature increases and we tend to get warmer, and therefore we tend to get itchier essentially. Yes. So in terms of like natural ways to increase energy production, I think it's really important to listen to your internal battery. I mean, there's all sorts of potential, supplements, probiotics that you could go away and individually research, and what works for one person might not work for the other. So I'm not here to advise on those sorts of things, but certainly looking at your internal battery, if you're able to stop. I'm so sorry if you can hear my dog in the background.
Is he scratching behind the ear, I think, at the moment?
He's eaten a toy, so I'm going to throw it out. There we go.
Was that a liver-shaped toy? It looked...
It's a watermelon, but it doesn't look like a liver. Just bringing a bit of realism and reality to the as the expert of my Labrador pouring in the background. So I think it's about looking at your internal battery and trying to... It's easier said than done, because if you're in the middle of work, and then suddenly you feel like you're on amber, it's about having a meaningful break. So whether that's 5 or 10 minutes just to recharge, because actually then you'll find that your energy is better and you're more proficient with your energy. Whereas if you allow yourself to get completely flat, completely red zoned, you will feel that your energy is very, very low, and then bringing it back up naturally may feel like it takes an age. It's always important to make sure you're well fueled and good fuel as well. So, whatever you're able to take within the restrictions of potential added IBD, making sure you're regularly well fueled is also a really, really sensible way to help with just general energy. And actually, believe it or not, and I've got to say it because I'm a physio, exercise as well. Now, that sounds really backwards, given that we're talking about fatigue and you want to improve energy. But actually, if we're trying to improve resilience, then it's about taking those 10 minutes. Can you move your body? And I'm not saying you have to go and run a marathon, but can you move your body to just naturally reduce potential cortisol and just allow for a bit of happy hormone, which therefore in turn will reduce stress within the body, which therefore in turn will help with energy production. So that's probably my top tips.
That's good. And I have some history with Alice. I was on a clinical trial that Alice helped me with some exercise. But I think that's very important, is that when you say exercise, you're not talking, necessarily about running a mile or running a half marathon. When we were doing it, it was things like get up and walk to the local shop and back and grab a copy from that kind of level of activity just to get moving. And I think people hear the word exercise and automatically jump to, I've got to be at a gym for an hour, that kind of thing.
And I think that's it might help answer a couple of questions, but it's also just thinking about, well, if we're thinking about exercise, how much do I do and how much is too much and what's safe and what isn't safe? Now, a really nice scale to use is something called the rate of perceived exertion. It's called the Borg rate of perceived exertion. And you'll see two types. There's a modified, which is 1 to 10, which I tend not to use. I tend to use the one that is 6 to 20. And the reason for not using the 1 to 10 is because if it's a scale of breathlessness. So if you're feeling very breathless, you might just automatically jump to 10 and go, I'm 10 out of 10. But actually, if you use the 6 to 20, it has little statements next to it and it offers how breathless are you. Now, the reason I'm bringing that up is because it correlates really nicely with fatigue. So if you're able to work within sort of a zone of 12 to 14, which is essentially you're aware you're doing some exercise, but you're able to hold a conversation, perhaps not as eloquently as I am right now, but if someone said your name, you could answer them back and you could be like, yeah, I'm aware I'm doing some work here. That has been shown to improve fitness whilst also keeping you within a safe target zone to improve exercise and fitness, but also help with fatigue levels. So if you absolutely annihilate yourself, the chances of you then being able to get up and do something with the rest of your day or the subsequent days is likely to be a lot less. So that's quite a nice tool to help manage how much exercise should I do and what, well, more sort of intensity, actually, not necessarily how much, but the intensity at which you should be pitching it at. It's quite a nice tool to use and it's completely independent. So what my 12 to 14 out of 20 is might be very different to Mark's, might be very different to Martine's. And that's the point.
It's definitely different to mine. you are far fitter than I am. That actually links into the next question, which is, should you or how do you know when to push through your fatigue to do some exercise or not? Is that something you should ever do?
It's a really good question. Only you know how fatigued you feel. Now, if it's the kind of fatigue which comes with significant symptoms of heart rate disturbance, dizziness, pain, sickness, then I would say it's not appropriate. However, if it's that feeling of and that muscle ache and maybe lower level pain, joint pain, when I say exercise, go out and do something that brings you joy, whether that be a short walk in the sunshine, whether that be moving your body, which you could argue is more physical activity than actual exercise. Exercise is classified as more structured with an intent to improve or maintain fitness, whereas physical activity is moving your body from A to B. So whether that's going outside for 10 minutes and just moving your body. And actually, if you're feeling that high level of fatigue and feel it's safe for you to move, i.e. you don't feel like you're going to pass out, you don't feel like your heart rate is very erratic, you don't feel very, very unwell with it, and you're relatively fueled, that's the important thing. You're not on an empty stomach. So you're trying to mitigate other reasons why you might be feeling fatigued. Actually, I would be an advocate of doing something gentle, even if it's that 5 minutes. Try and break that cycle of it's only 5 minutes, what difference is it going to make? Because you actually might find that 5 minutes turns into a 15-minute lovely walk and enjoying nature for nature, if that's your thing, or enjoying the garden for the garden, or enjoying moving around your house and listening to some music. You know, find something that brings you joy just to see if you can change your mindset in that moment.
Thank you. The next question on my list is I really like this question is what do you think spouses or family or support networks need to understand about the symptom of fatigue? If there was something you could sort of wave a wand and get them to understand fully, what would it be?
So I've got 2 top tips here. The first is as a patient that suffers with fatigue, my experience of what patients have told me, I have never experienced it myself, is the frustration around friends, colleagues, family members go, me too. I'm tired as well. I'm really tired.
Yeah.
It's really frustrating for patients because it's a totally different level of fatigue. Everyone has the permission to be fatigued. Absolutely. I'm not here to say they don't. But when it comes to a fatigue-related symptom from a chronic condition, it's very, very different. And it can feel very disempowering to patients for them to hear other people go, yeah, I know, I didn't sleep either last night. really, really frustrating. So that'd be the first thing. So try and just be mindful of the language used, try and empathize, try and ask the patient, how does it feel? How is it making you feel in terms of, does it feel centrally, peripherally, or if you haven't got those words, is it foggy headedness, or is your body hurting, or do you just feel like you need to lie down? That'd be my first tip. And the second tip is about then empowering your colleague, your family member, your friend, etc., and saying, I hear you. What do we need to do to try and help? What do we need to try and do? You'd been advised maybe to try this, or we really need to focus on your sleep, or we really need to focus on moving your body. There's a real tendency when patients have a condition for family members or friends to say, oh, so sit down, you sit down, I'll go and do this, or, no, I'll run and get this, or no, I'll do this. And that's great. And there might be times you need to call upon that. But actually what it's doing is adding to a debilitating decline in functional ability. And you've all heard, if you don't use it, you lose it. Now, that is for anybody. But when you've also got a chronic condition, you're at much higher risk of losing your muscle function because relatives want to sort of rally round, which is brilliant. But it's about being empowered as a patient and saying, no, there are things I can do, and actually adds to my mental cup and well-being and my physical fitness. So they'd be my two points for family members and carers and friends.
A good, very good answer, actually. I really like that. I had people, Sport Network, taking things on, and I felt that more psychologically than physically. But them going, don't worry, I'll do this. It's like, well, I can still do that. I'm still capable. And that was my personal issue with that, I suppose. So if we could have given them that information, that would have been brilliant. Another question about exercise, is there a particular form of exercise or type of exercise that would specifically help with fatigue?
So that's something that's a little bit unknown. If anybody is interested, there was a small feasibility study that I completed. It's called the Excited study. However, it was predominantly in primary biliary cholangitis. So still an autoimmune condition, but very different to PSC, as we know. And it was about using graded exercise. So that's that intensity again, so that rate of perceived exertion where you're aware you're doing some work, but able to hold a conversation. And it was actually finding a nice balance between both resistance work and aerobic. So by resistance, we could just mean your body weight. So an unweighted squat is absolutely acceptable versus a walk, which is that aerobic size, that more cardiovascular fitness. Now, if you're somebody that's already very au fait with exercise, you're already in the gym, what I would probably say is that we're trying to improve strength and stability. So that sort of set reps of 8 to 12. Now, if you're on some days not able to get anywhere near 8 repetitions, I would say, in line with your RPE, whether that's a fatigue issue or not, I would say you need to reduce the intensity. So that would be reduce the load. That's not to be seen as a failure. It's to be seen as a natural regression of what your body needs. Fatigue or no fatigue, every athlete has days like that. So you are all athletes, so you need to bear that in mind. And the same if you're with ease getting to 12, well, what are you trying to achieve there? So actually, do you need to increase the weight itself? So resistance wise, 8 to 12 repetitions, 2 to 3 sets. But if you're really just beginning, I would say just aim for eight repetitions of one set and trying to target all areas of the body. So, 4 or 5 exercises, 1 for arms, 1 for legs, or 2 for arms, 2 for legs, and 1 for the middle, is a really nice way of it not being too intrusive, because you're all very busy people. You can't be doing exercise for hours on end. So short and sharp, moving with purpose, using that RPE to help guide you, and a blend of both. But I would always say start with something that makes you sing. So if you like walking, walk. If you like resistance, start there, because that's going to get you going. Whereas if you try and do something that's really alien to you, the likelihood of not continuing or for it not to be sustainable is much higher.
That's really good. Thank you. The echoing the thing that you're used to as well, I think is very, when I was part of your trial, I usually did walking. Walking was the thing I liked doing. And then once I decided to switch it up to swimming, that was so much harder than like just making the change that my body wasn't used to. And where I thought I could achieve in swimming was not where I was at all. And that was a bit disheartening. So doing something I think that, like you say, you find joy in, that you do often is useful.
Yeah.
There's a question here about the impact of mental health. Do you know if there's been any research into impact of mental health on PSC? and its fatigue, or how those three things interrelate?
Not to my knowledge has there been anything very robust looking at the direct impacts of mental health, fatigue, and PSC. But if we look at the wider sort of chronic condition network, even outside of liver, there's an absolute pile of evidence to suggest that mental health contributes to fatigue. So I don't see why it would be any different in PSC. That's absolutely not a criticism. It's a known mechanism. But it's then how do we lift that mental health? How do we actually target the main symptoms? So yes, fatigue might be a byproduct of it, but actually how do we address the mental health? And again, patients often get told, well, it's just your disease, it's making you feel flat, it's making you this. They don't look at the person. And quite often in my clinical experiences, patients feel they've become defined by their PSC. So they were once a person without having PSC, but now they're marked with PSC, or now they're Alice with PSC, or now they're this with PSC. And that is just a massive cognitive load to carry around. But so yes, to answer that question, I very much truly believe that mental health can have an impact on fatigue. And I think whoever's asked that question is very brave, because I think it's a really important thing that we should be discussing. And there is no shame around saying, my mental health is really suffering because of X, Y, Z. And even if you can't pinpoint why, just acknowledging it is a really important part of the process.
Brilliant. Thank you for that. And I've got like a personal mission around mental health. I believe the symptom burden of PSC is very high, and I personally had issues with my mental health, and I'm quite open about that. But I think it's something we do need to talk about more, and again, maybe talk to the doctors about more so they realize it's an issue.
Absolutely.
I'm going to refresh the list. Does your pattern of eating at all, like the times of your meals, how much you eat, affect fatigue? And are there, because of that, any recommendations around it?
I can certainly give you, to my knowledge and clinical experience, get my little proviso in. As a dietitian, It's hard for me to advise specifically on what you should be doing. But again, it's about looking at yourself as an individual. Even stretching back, if you can remember a time when you weren't burdened with your liver disease, what was a normal eating pattern for you? And was it dysfunctional or was it regulated? And that's not a criticism again, but what are your normal eating patterns and what made you feel good and what didn't make you feel good? So were you somebody that actually benefited from larger portions, or were you somebody that benefited from regular snacking? What we do know absolutely congruently in liver disease is that long periods of fasting are not good. So if you've been advised or you are fasting for long periods, that is not going to help, because of the way in which your liver can store, or in your cases often is dysregulated, store the excess energy. So when we eat, your body takes the energy it requires, and then any extra goes in the form of glucose to the liver and is stored as glycogen. Myself, if I then didn't eat for 5 or 6 hours, I might feel a bit irritable, but I'll be okay, and my liver will break back down that glycogen into glucose and provide my cells with energy. Now, in patients with liver disease, anywhere within the pathway, that system can be dysregulated, and therefore you just don't have the energy reserve or the storage. So your body naturally goes to the muscle, and that in itself is really, really nasty, because it takes a lot of energy to break down muscle, which is counterproductive. And then the byproducts in which are produced in the breakdown of muscle are quite toxic to the body, and also re-releases nasty things in the body that can make you feel really lethargic and unwell and a bit confused even at times. So what I would say in terms of meals is I would higher protein if your body can cope with it. It may be that you have specific triggers with IBD, so it's being mindful of those, reducing fasting periods, and in my experience, frequent and smaller tends to be better than larger and fewer in terms of energy reserve. And certainly if you're going to demand on yourself cognitively or physically, it's always good to have something in the tank.
Thank you. I've just looked up at the time, and I'm scared that we've got 13 questions outstanding. This is the most questions I think we've had. We've got someone saying that this is more of a comment than a question, but I think it's worth repeating, is they were just told they needed to accept their levels of fatigue, that it was the new normal for them. And even when they went to some sort of talking therapy around it, that was around accepting their new level rather than it being absolute. And that breaks my heart. And I'm hopefully we can do something about that in the future.
I mean, I do think from a mental health point of view, it's important to accept where you are, but you don't have to accept that is acceptable. If that makes
Yes, that makes
Yeah.
sense. Should we try and rapid fire a few questions?
Yeah.
Is fatigue something that can flare up and down again, or once you hit a certain state, are you there forever?
No. A quick answer, it absolutely varies. In my experience, people can be really burdened and they can have really good periods. And it doesn't necessarily tie in with disease severity, but it might tie in with lifestyle.
That makes very good succinct answer. Thank you. This is one that I could have asked, and it is anonymous, so it definitely isn't me though. Is it okay to use caffeine to energize yourself, or does this actually make things worse?
Again, I guess with any stimulant, because it is a stimulant, it's how does it make your body feel and what are the lasting effects on. Slower release caffeine, so some things like matcha are a little bit kinder on the body than maybe a big stimulant from, I would never be an advocate of an energy drink, but something like coffee. I'd say something like a matcha powder is a lot more natural and it gives a slower release of caffeine, although there is more caffeine in it, it just is kinder on the body and you might get less lulls. So anything high intense in caffeine, you might get a really good hit, you might have lots of energy, but then your crash after is likely to be greater. But again, this varies between individual. If you're someone that's used to caffeine, then you might not notice, but it wouldn't be something I would reach for unless it was in as most natural a source as possible.
That makes sense. I've never tried matcha. I will add that to my list.
Very nice.
This is yeah, really. Oh, is that okay? I'm going to look forward to that. But a question I think that a lot of people will want to know the answer to is, and do you know if fatigue persists post transplant?
So yeah, so in my experience, there is a handful of patients that will report that their fatigue is still prevalent post-transplant in cholestatic disease. Why that is, it's unclear. What we do know is that those that have done what they can to try and manage their fatigue or inform themselves on their fatigue, the fatigue still tends to be reduced. So it might still be there, but they're better at managing it. So it's meant to be a hope answer. But on the large part, fatigue is significantly better once the cholestatic disease is, well, not removed in PSC, but essentially you've had a liver graft, there's better liver function. But it tends to be that actually patients are better informed. So if they have got fatigue, they know how to manage it post-transplant.
That makes sense. And that mirrors my experiences. I still get fatigue, but it's not at the level I had it at, and I'm able to manage it better. It's worth asking. You mentioned sleep, and getting good sleep can be something that helps improve fatigue, or could be an indicator that fatigue is coming from that. Do you, or have you got any experience with things like melatonin to improve sleep, or is it better to use natural methods to try and improve sleep?
Again, it's about checking in on yourself and what your sleep pattern is like, and how you calm down after a day, if you like, and how you get yourself into the zone ready for sleep. I would never personally promote melatonin, but I've also not been deprived of sleep. So that's something to have a conversation with your clinician about. Things that you can actively do in a more natural way is making sure that your space of sleep is your space of peace. Removing any external source that can be triggering, i.e. don't work in your bedroom, do things that bring you joy, whether that be reading, whether that be relaxing, whatever it may be. There's mixed evidence around blue light, but personally, to try and help switch your brain off, I would always recommend, try not to be watching the telly to fall asleep. But some people from a mental health point of view need that because they need to cut through the chit chatter in their head. So I'm not saying you should have everything off. I'm just saying try and find what works for you, and try and move things out that bring your stress out of the bedroom and try and make it as peaceful as possible. You're there to sleep. So that's what you should be doing in that space.
Thank you. I'm aware that I don't want to ask you anything that's sort of outside your remit or your expertise to talk about. So there's a question here about strategies that can be used in the workplace and employers and helping people with fatigue. Is that something you've had experience of at all?
Yeah, absolutely. And it's challenging because not every employee understands what's required. But the short, sharp breaks whether you have fatigue or not, it's actually proved to be very beneficial for people in general. So those pauses, particularly if you've got desk-based jobs, you know, you have 10 minutes away from your desk, actually it can rejuvenate you in a huge way to allow you to be, you know, more efficient when you return. Other things to help wake you up, so over your lunch break, and I know it sounds really backwards again when you're feeling tired, but can you move your body? Actually, you might find that after lunch and feeling very fatigued, if you then continue to sit, you're just literally the shutters are coming down. And also trying to recognize your periods of fatigue and that are personal to you, and is there any flex there? Are you best in the morning? So could your higher demand tasks be in the morning, and shuffling around how you complete your work? And it's not always possible, but you know, don't be afraid to be an advocate for yourself and say what you think you need, and then see if there's a compromise with an employer.
Brilliant, thank you. And yeah, I think there's variance in how understanding employers can be. I think some people are very lucky with the accommodations they can get, but when it comes to disability, there reasonable accommodations should be made. So that's always something to keep in the back of your mind. We mentioned exercises and doing the resistance exercises, and are there online courses or online guides that someone could use if they're looking at starting that at all?
Yeah, so if it's something very new to you, if exercise is quite alien, again, probably what I would recommend is, just for reference, is reading something like the Excited protocol and results, because there's examples of types of exercise that you could be doing alongside guides on how much you should be doing. From an aerobic point of view, so that's from a heart rate point of view, it's picking something that's safe for you. So if you're not used to exercise, walking, and, you know, say, for example, you can at the moment do a 20-minute walk. Can you, within a couple of minutes of that walk with more intent? So can you raise your heart rate a little bit? Can you raise your breathing a little bit? Can you work your muscles a little bit? And then next time, is there a potential to increase that further? You might not be linear, you might not be progressive, and it's important to acknowledge that. PSC is undulating, so you might do this, and that's absolutely acceptable. So I would say maybe look at the Excited study for basic exercises that you might think are doable. The point of the ones chosen meant that you don't need a gym, you don't need specialist equipment, etc. So anyone can achieve them. And then from an aerobic point of view, picking something safe and just gradually increasing minute by minute and moving with intent, as long as it's in line with that rate of perceived exertion.
Brilliant, thank you. I'm going to do one last question, and then we are very close to the end of the time you've so graciously given us. It's a question about mental fatigue. How do you manage the mental fatigue? But it says here, by the end of the day, I just want to switch off and not engage in conversations. Is this associated with PSC, or is this just my lazy mind? And that was their words, not my words. I just want to make that clear.
I think it probably is most likely an element of overwhelm or central fatigue. Only yourself know what that situation is, whether your job is very intensive or whether you just find your day very intensive. There's almost certainly little knocks on your brain door that you're tired throughout the day. It's unlikely that you just get to the end of the day and you're suddenly at that point like a switch, as in terms of you don't want anything more. You might have had some little subtle signs, so you're getting a bit more frustrated towards the end of the day, tasks are getting a bit more challenging, and you know, there will be subtle signs. So it's about picking those up in the afternoon and seeing, what can I have just 5 or 10 minutes just to myself, just to recharge, regroup and go again. And it may help with just that at the end, that actually you feel you can engage. Or do you know what, ring fencing that time at the end of the day and saying, right, for an hour after I finish work, I need nobody to speak to me. I'm not going to go to sleep, but I need to mentally recharge, and therefore I'll be more present for the rest of the day. And it might give you more just by taking that hour to yourself, that dark space or light space, or sitting in a park or whatever, where you don't speak to anyone, you plug yourself into whatever you want to plug yourself into, having that time and ring fencing it, if it's of course possible with life commitments.
That life gets in the way sometimes.
But it can make you more present, and it's sometimes changing and reframing. So actually, is 50% of you for 5 hours potentially with a busy family better or worse than having half an hour, 40 minutes to yourself to then offer 90%? Only you know the answer to that question. I'm not here to judge which you choose.
Thank you. I'm going to have to call it to a close. It's fascinating to have these conversations with you, and I want to really express our thanks for you coming on to offer your expertise. You're giving your time for free to us to answer these questions, and I'm very sorry to the 8 or 9 questions that we still got remaining, because they keep coming in. Maybe we will revisit something like this again next year.
The only thing
go
I can
ahead.
suggest, Mark, is if there's questions, obviously myself, I'm not going to be, providing my contact details, but if people wanted to, if there was an opportunity to email yourself, then I'd be happy for you to contact me, Mark, and I'll see if I can answer them and provide them back with the ones, so people don't feel like they've missed out.
Thank you. And we filled up our Ask the Experts for this year pretty much, but maybe next year we can look at having you back to answer all of the other questions that people
it's always a pleasure.
And we didn't touch on it today, but Alice is doing some research into fatigue and PSC, which I'm sure we will have you on to talk about in the future, which would be amazing. Speaking of the future Ask the Experts, we've got 2 in September, just because of the way scheduling worked. We've got one on Tuesday, the 16th of September. That's about PSC variants. So that's about what's the difference between large duct PSC and small duct PSC. What about AIH overlap and variants like that? That's being done by the amazing Dr. Chapman, who's going to come and talk to us. And then on Wednesday, the 24th September, we have a flat out PSC Ask Me Anything with Dr. Yeoman, who isn't going to give a presentation and will just answer your questions out of the wild with no preparation, which I'm sure will be very, very exciting. We will have another Ask the Expert in October and November as well, but I don't want to announce them just yet. And finally, we have our in-person information day coming up in Leeds on Saturday, the 13th of September. So basically, September is a great PSC month for us, but Saturday, 13th September in Leeds. You can register on our website if you would like to come along to that. So I'm just left with saying, once again, thank you to Alice. You have been amazing. Thank you very much to Martine in the background, who has been an amazing help in organising all the questions and making sure I don't get lost, and also coming in when I just summoned her, and I'm so sorry for springing that on you. And I will say thank you to everyone for taking the time out of your evenings to watch. I will hit the end button. As you might all know by now, Zoom is very rude and just ends everything immediately for everyone. So I will say good night and good evening to you all now.
Thanks
Thank you again, Alice.
Thank you. Take care. Bye.
Bye-bye.